I'm Brian Weatherby. I'm a foot and ankle orthopedic surgeon with the Steadman Hawkins Clinic of the Carolinas here in Greenville. I practice at the Patewood campus and I also practice over in Spartanburg and out in Simpsonville at the Hillcrest location. I chose the field of orthopedics because I like the idea of being able to address a problem in a concrete manner and not just think about it abstractly, but actually address it with my hands, fix the broken bone or reconstruct the deformity or replace the joint. I didn't want to do a medical field where I just prescribed medicines or thought about conditions and ordered tests, but actually went in and addressed the problem and came out of the operating room or came out of the situation with the notable answer. Growing up, I did have a condition with my hip at a young age when I was about 5. It's called leg calf perthes, where the ball and socket hip joint didn't form right, and so I was exposed to orthopedics and had extensive bracing and therapy for that, and I obviously had injuries playing high school sports, breaking a bone in my wrist, meniscus tear. So, having experienced that myself, I'm definitely sensitive to patients' issues that I see them for, and very much empathetic and care about them for those reasons, and want to do everything I can to get them better and get them back on the road to recovery. I grew up in the state. I grew up in South Carolina, so I went to high school here in the state. I went to undergraduate at Wofford College in Spartanburg down the road. From there, I went to the Medical University of South Carolina, which is in Charleston. From Charleston, I matched into my residency, my orthopedic surgery residency at the University of Tennessee at the Chattanooga program. From there, I went for an additional year of subspecialty fellowship training for foot and ankle orthopedics in Houston, where I was able to be involved at the Baylor College of Medicine at University of Texas, at the Texas Orthopedic Hospital. I was involved in the sports medicine care of the Houston Rockets and several other professional teams there. And then after that, I was fortunate enough to begin my practice here with the Steadman Hawkins Clinic of the Carolinas in Greenville. I really see patients with all types of conditions and abnormalities. I'm doing everything from ankle replacements to arthroscopy to bunions and hammer toes, kind of the whole gamut. I do enjoy doing arthroscopy. I do enjoy doing ankle replacements. Those are very rewarding procedures, but I wouldn't say that I specifically focus my practice on any certain one. I think it's important to spend time with patients. I think that they need to know what their problem is, what they can do to help treat it, whether it be no surgery, non-operative or with surgery, what the reasons for that are, what those treatments entail specifically from a technical standpoint, what they can expect once those treatments are undertaken, and what plan A, B, C, and so forth and so on will be in the future. And I think that I try to make myself unique by taking the time to listen to the patient, hear those concerns, hear their concerns, and then discuss those with them, lay out the treatment plan, lay out all the different parts of whatever the algorithm of the treatment may be, so that they just leave thinking that I actually care about them like I truly do, and I empathize with their situation, and that no matter whether certain things will happen, there'll be a treatment plan in place, and that at the end of the day that that I am, that their doctor's gonna do everything he can to make them better. I think what makes the resources and the services of our group of the Steadman Hawkins Clinic here very unique is that there's only maybe a few places in the country, or for the world for that matter, that really carry out the mission statement that Dr. Hawkins so adamantly speaks about. We are fortunate enough to have the resources, meaning the people, the facilities, and the services because of those resources to undertake very extensive research projects, so that we generate answers for problems that are cutting edge, and that hopefully address these problems in a better way than the answers that we already have, or the techniques or implants that we already have. We were involved in both fellowship and residency training, so we are heavily involved in academics because of both of those reasons. And as a result, as anyone knows, when they are teaching or instructing another person on how to do something, that always keeps you really more on your toes or more on the ball. You obviously want to make sure that you're up to date, that you're studying, reading yourself, doing research, so that you pass on the appropriate techniques, the appropriate clinical decision-making skills, just the way to take care of treatment or take care of patients in the best way. If I wasn't an orthopedic surgeon, I think I would probably be wildlife biologist or be involved with forestry. I really love the outdoors, and that was my passion. When I was younger in life, and still is a passion of mine. So I think if I wasn't doing what I was doing right now, I would be involved with something to do with outdoors and research in that area. So if I had some me time, you definitely find me hanging out with my family, with my wife and my son, and I'd probably be doing that in the outdoors somewhere where I could fish and just relax by the water and take it easy and just breathe some fresh air. The most rewarding thing I find about being a doctor is just being able to, successfully help my fellow man and take somebody that has a very bad problem and physically correct it with an orthopedic procedure and get them back literally up on their feet.